Nice. Good there, nice. That's it, good, nice. Nice, that's it, look at me. Right there, guys.
My name is Dr. Anthony Youn, and I'm known as America's Holistic Plastic Surgeon. On this video, we are going to have fun watching an episode of Keeping Up With The Kardashians. The Kardashians and plastic surgery go together like peanut butter and jelly. You literally cannot separate the two. So as a board-certified plastic surgeon, I thought it'd be fun to watch an episode of Keeping Up With The Kardashians with you and react to it. Specifically, the one regarding Kris Jenner's facelift.
What's bugging me is my face. It's like I have jowls. If this was just like, this needs to go, look.
This is very common for me to see women who look fantastic come in. Kris Jenner, she's maybe 60, and she's got a little bit of jowling, a little bit of looseness, and they think that they look terrible. When they don't, they look fantastic. Unfortunately, it seems like Kris is comparing herself not to 100% of women her age, but the top 5% of women her age and how tight their neck is. So does she need a facelift? Well, you never need plastic surgery. Does she want one? Looks like it.
Right now, time is not on my side.
Just quit obsessing on yourself.
No, I won't.
Quit obsessing on yourself and listen to me.
Myself. No.
Listen to me. Listen to me.
So do you think that Kris Jenner is a little bit self-obsessed? Do you think the Kardashians are a little bit self-obsessed? At least she admits that she is. I mean, so many of us in today's selfie generation and reality TV show generation are so self-obsessed. I mean, people might even accuse me of being self-obsessed, but I don't think I am. Am I?
You would say putting a wedding on is stressful. How about business? Stressful? Okay, now you're going to throw facelift. Getting knocked out. Little stressful? Why do this all at the same time?
Getting knocked out right now sounds like a gift from heaven. I'm the person who never wanted to be put to sleep. Right now, that would be heaven.
As a plastic surgeon, I have patients all the time tell me that I'm so looking forward to being knocked out for surgery because it's the only time I'm going to get some rest. Well, getting rest by anesthesia is not a good way to get rest. This is not restful sleep. This is anesthesia sleep, where you are getting your body pumped with different types of chemicals that could be potentially harmful the more that you do it.
I'm at Garth Fisher's office for my pre-surgery consultation. So if you had a big event to go to,
yes,
like a really big event,
yes,
how much time would you give yourself?
I would give it at least 3 months to feel really, really good. Your body's using all its energy to heal the face.
Yeah, I don't think I have 3 months, but I probably could give it a good month.
Yes.
Yeah.
A good month, you'll be okay to recover.
1 month? 1 month is not enough time to have a facelift, recover from it, and be guaranteed that you're going to look good for a wedding. Typically, after a good facelift, at 1 week, you look like hell. At 2 weeks, you start looking pretty good, and most people look pretty darn good between 2 to 3 weeks. This being said, most people do have swelling that can persist at least 2 months, and for some people that swelling can persist 4 to 6 months. So for her to say, I've got 1 month, well, I mean, it's possible she may look pretty good at 1 month.
Cute.
How are you?
Yes.
I've never had such a stressful morning, honestly, in my entire life. Nobody's being soothing. They've told me every horror story that they've ever watched on television.
A girl got shot 27 times and survived.
Oh my God.
Kim.
This is so wrong on another level.
I'm feeling a little scared and anxious, and my children seem a little preoccupied with their own life.
Mindset really impacts how you heal. And if you're with somebody who's very negative, who is making you more afraid, making you more scared, more anxious, then you may be more likely to have a complication. So that is something that I try to encourage my patients to do. Do not bring somebody with you to surgery who is going to belittle you, who's going to tell you that you're making a mistake. And God forbid, this is very common. I get spouses that start asking me about all the various horrible complications that can occur right before the person goes into surgery. Patients will ask, or the family that will ask me, so what are the chances that my husband's going to die? What are the chances that she is going to have a major complication? What's the chance she's going to have a bleeding episode or a massive infection or tissue necrosis? This happens all the time. So definitely bring people with you who are supportive. And I don't know that that's necessarily what Kris did.
Rob and I are just trying to lighten the mood. My mom is a little over-dramatic. She just shouldn't worry about it. She's in great hands.
Kris Jenner's doctor, Dr. Garth Fisher, is a very well-respected, highly respected, board-certified plastic surgeon in Beverly Hills. I actually met him briefly once, seemed like a really nice guy, but otherwise I don't know him personally, but I do know his reputation, and his reputation is definitely stellar.
Ready to go? Scoot up to the side here just a little bit. Put your chin down, like that.
I think my mom is so petrified to go into surgery.
So this will kick in pretty quick, maybe, 20, 30 seconds.
I think she's afraid that she won't wake up.
I find that the most common fear that patients have when they undergo cosmetic surgery is the fear of actually anesthesia. Much less so is the fear of looking weird afterwards or having a bleeding complication or a blood clot. Those types of bleeding and blood clots, that's what worries me. But interestingly enough, most patients are actually worried about the anesthesia and about not waking up, just like Kim had mentioned. The good thing is that anesthesia is very different now than it has been even 20 or 30 years ago. It's much, much safer now than ever before. And you'll see later on that she is under the hands of a good board-certified anesthesiologist, which is key.
See you all later. She's asleep.
I don't think Kourtney and Khloe are taking any of this seriously. I think that they just don't want to think about anything at all having to do with the surgery. Yeah.
Now, briefly, they showed a picture from an endoscope, and that was where actually you could see a camera. And what it appears that he is performing is an endoscopic brow lift. An endoscopic brow lift is a surgery where typically we make 5 little incisions in the scalp and basically lift the forehead, the skin, from the bone to lift the actual eyebrows up. So 5 little incisions up in the scalp, and it allows us to lift the eyebrows up without performing major surgery. So Dr. Fisher appears to be performing a facelift. During a facelift, we make incisions around the ears on both sides, as well as an incision down underneath the chin, and we basically lift the face up by removing excess skin, removing unwanted fat pockets, and tightening up the underlying muscle layer. It does create permanent scars around the ears on both sides and a little scar down here. A very popular surgery. This is something that I probably do in my practice once a week or so.
Constantly, I'm thinking about my mom this whole day. I'm a little scared for her. Surgery is taking a little bit longer than I thought. It was supposed to be like 6 hours, and it's taking like 9 or 10.
9 to 10 hours is a long time to be under anesthesia. In my practice, I limit the lengths of my surgery to about 6 hours. And the main thing that we worry about with longer operations is the risk of blood clots. You can get a blood clot in your leg because your legs aren't moving during that operation, and if it travels to your lungs, you can literally die within minutes. It's called a pulmonary embolism. So is 9 to 10 hours too long to be under the knife? It's definitely on the longer side, and we'll see whether they may be exaggerating a little bit for TV, but definitely I would be a bit concerned if the surgery is taking that long for a facelift.
I finally got the call that my mom is out of surgery, but I'm just really curious and anxious to see why it took so long.
Hello, how are you guys?
Hi.
Dr. Ackroyd, the anesthesiologist.
Nice to see you again.
How are you?
How are you?
Good to see you.
Oh, you guys worked like all... Is this like one of the longest for you?
Her surgery went absolutely perfect. Her neck looks beautiful, her jawline. I mean, everything's very natural, very conservative. She's all good.
So that's great news that her surgery went really well. He did mention that he did the surgery conservatively. That is something that is really important. I do get a lot of patients who come to see me and they say, be aggressive, be aggressive, be aggressive. Well, you can be appropriately aggressive and still be safe. And I think that's really the key. When you're doing a lifting of a face and a neck, you don't want to be too conservative, because too conservative means that things are still sagging. You do want to be aggressive, but the problem is if you get too aggressive, then you start looking like your face is in a wind tunnel, and that's what you don't want. Now, one thing to keep in mind for those of you who are watching who may consider a facelift at some point is that it's very, very difficult to get somebody to look like they've been in a wind tunnel after just one operation. So if you look at celebrities who don't look right, who've had too many facelifts, it's because just that. They've had too many of them.
She's like totally out of it.
She looks gorgeous.
Okay, coming back to the world.
You're gonna be so happy. Now we're really twins.
She does look good after her surgery. Now you may be watching this and saying, oh, she looks like she's been beat up and what are those things sticking out of her? Actually, for her being right after surgery, she doesn't look that swollen, especially from her endoscopic brow lift. Sometimes people have that endoscopic brow lift and they already have raccoon eyes after the operation, and she does not, which is a good sign. So you may also be wondering, what are those plastic things on the sides of her head? Those are drains. Drains are basically there to drain out any inflammatory type of a fluid that can develop, or even a little bit of blood, in the areas that he's operated on. And if I do an endoscopic brow lift, I typically put a drain in through one of the side incisions, and then with the facelift, I typically put one behind each ear as well. So typically that would be 3 drains for those 2 operations, and it looks like that's what Dr. Fisher did.
Mom, we're gonna move you to a different bed, and we're gonna go to the hotel right now. We're here, Mom.
In my area, Metro Detroit, when I do facelifts, I keep my patients overnight at the hospital that I operate out of. I operate out of an outpatient surgery center, and it's attached to a hospital. However, I have worked out in Beverly Hills many, many years ago, and in Beverly Hills, it's a little bit different. People have their surgeries often done at private surgical centers, and then they spend the night in hotels that are specially made. They have rooms that are set aside, actually, for plastic surgery patients. And these rooms that are set aside usually have nurses that will monitor them, as well as supplies and things like that. They're not quite equipped like a hospital, but definitely safer than being at home.
Do you want me to take a picture of you and show it to you? Yeah. You do? So that is like the little drain. That's it, like the drain. And then no bruising. It looks gorgeous. You literally look like you're my age. Good night, I love you. So I'm gonna just be right here, okay? I love you too.
As much as Kim Kardashian gets so much hate from people around the country and around the world, she really is acting as a good daughter to her mom. So you gotta give props to Kim for being such a good daughter in this situation. And it's true, Kris does look really good, and if you take a peek at future episodes of her, you'll see that Kris really did well with that facelift and that her surgeon did a really good job. So that was a lot of fun. I've actually never watched an episode of Keeping Up with the Kardashians because I, in general, can't stand them. Kris Jenner's surgery was performed conservatively and she looked fantastic afterwards. But unfortunately, that doesn't happen to everybody. Some people get botched. Check out this video right up here of a woman who underwent cosmetic surgery by a real plastic surgeon and did not get a good result. And let's see what happens when she actually gets it fixed up. Check it out.